Good afternoon. I am Shankar Raj, President of newly based HEAL Foundation. Welcome to the 10th episode of the hour-long fortnightly series brought to you by IHL Wellness in association with HEAL. We are live on Facebook and YouTube. This particular episode, that is the 10th episode, is on PCOS or polycystic ovary syndrome, a hormonal disorder common among women of reproductive age. Women with PCOS may have infrequent or prolonged menstrual periods or excess male hormone or androgen levels. The ovaries may develop numerous small collections of fluid or follicles and fail to regularly release eggs. But to speak more on this, we have with us Dr. Shraddha Ramchandani, the consultant in the Department of Obstetrics and Gynecology at AIG Hospitals, Gachibowli, Hyderabad. She has 18 years of experience in this field. Also joining us is Ms. Nazneen Hussain, Senior Dietitian in Mumbai and runs Freedom, a Beginning to Healthy You, a lifestyle management center that includes a holistic mind, body, and soul approach in treating lifestyle ailments. Welcome, Dr. Shraddha. Welcome, Ms. Nazneen.
Hi. Thank you so much for having us.
Yeah, thank you. And it's always nice to see you. How is Hyderabad, Dr. Shraddha? Fine? No rains?
Yeah, no rains presently. I think it was all over in the first month only.
Okay, not like Bangalore, your counterpart city. Yeah, I'll start with you. Can you explain to our viewers what exactly is PCOS?
See, PCOS is an endocrinological abnormality, which is most commonly seen in women. In women, this is the most common endocrinological abnormality which we see. And it is day by day, it is increasing more and more, and we see more and more patients coming to us, mostly with self-diagnosis also. So it is an abnormality in which we see different types of features, like it may be menstrual irregularities because of the chronic anovulation, that is estrogen disturbances. Then also we see male hormone, that is androgens, excess of the androgen hormones are seen. And then, as the name suggests, polycystic ovaries, there is typical appearance of the ovaries on ultrasound, from which this syndrome gets its name. So all this is actually, it's a triad of symptoms which we see. So that's what we call the polycystic ovary syndrome.
Now, you just said in your opening remarks that these days you see more and more cases. Why is that?
So why is that? Because of there is change in the lifestyle patterns. As compared to the previous lifestyle, the lifestyle has changed. More and more of the sedentary lifestyle, which we can say, and the less of the physical work. Then there are diet changes, there are changes in the sleep pattern, and overall, there may be increased diagnosis also, because now the patients, even the adolescent, are very much aware of their health and all the abnormalities. So mostly, as I told you, they come with the self-diagnosis. Yeah, I have this. It may be over-diagnosis or what, but they come with that. So all these lifestyle changes are the key for the increased incidence.
All thanks to Google, you can do a lot of self-diagnosis these days. But is it right to say that if I say that, as you said, it is because of sedentary lifestyle change, change in eating habits? And so, is it correct to say that rural women or women who work hard in the rural areas, they don't see this particular symptom?
No, the incidence is definitely less in the rural area as compared to the urban area, and even in the adolescent group, and all this are definitely. And there are many other reasons, that sunlight exposure, that is also one of the reasons. So they are considering all these factors. There is a lot of difference in the incidence.
I'm asking this question because in our last episode, we had a very famous Padma doctor, a cardiologist who had come here. And he made a very interesting statement. He's from New Delhi. He said, I see most cardiac cases in Delhi, but Haryanvi women who carry, loads of firewood for miles together and come, they have a lean figure and they don't have much of health problems. So probably it is because they exercise or they have an exposure to sunlight and their eating habits. They come home tired, sleep, and they get a good sleep. So probably it's because of that. Do you think that way? Yeah. So how do you say, how is the situation in the rural Andhra Pradesh, or rather you're in Telangana now,
See, we don't have the exact data. Unfortunately, we don't have exact data of the urban area and rural area separately. Nowhere we have that data. But overall, we can say the incidence is around 5 to 20%, we can say, overall in the population. Even in, yeah, overall population. Even in my OPD, I can say that 20% of my patients are come with these problems only, PCOD related issues only. So
now, can PCOS be predicted early on?
Means before the symptoms develop?
Yeah. Can you say that this particular candidate is surely going to get PCOS?
No, surely we cannot say anything. But yeah, though these things, PCOD features, they manifest in the reproductive years, that is 20s and 30s. But actually the etiology and whatever etiopathogenesis, it starts in the adolescence only. So during that period of time, we see, we identify the adolescent who are at risk. We don't say that these are the PCO patient, but now we have recent guidelines. PCOD International Evidence-Based Guidelines are there in 2018, in which we have created a definite group of the patients, adolescent at risk of PCOS. Exactly as you told, to identify the patients who will be at risk. And these women, they don't have all the three criteria, which we say, which are essential for the diagnosis of the exact PCOS. All the criteria may not be there, but there are few symptoms are there, and other ultrasound features and other things are there from which we identify that, yeah, these women are at risk of getting. So at that point of time only, we can advise them regarding in their lifestyle changes and other things, so that we can at least delay or prevent the things from occurring.
So as a doctor, what would you say is the exact remedy for PCOS?
Pardon?
What is the remedy for PCOS? Treatment?
Treatment depends on what are the symptoms. So in the treatment, we have actually two goals. First of all, we have to take care of the symptoms with which the patient is coming. There is no treatment like this. This is a medicine to cure the PCOD. It is not like that. It is a tendency which will always be there. So what we have to do is we have to take care of the symptoms with which she is coming. And another important goal is to prevent long-term complications. Because PCOD is not only amenorrhea or menstrual irregularity or acne or abnormal hair growth. That is not the only thing in PCOD. There are many long-term consequences are there which we are more worried about. So we have to take care of both the things. So treatment depends on the presently what she is presenting with. If she is presenting with menstrual irregularities, we start on the hormonal therapy depending on her age, depending on her desire for the fertility. Then if she's having hirsutism, mainly we start with the lifestyle management is the key. So first of all, this is the first line treatment, lifestyle management. If that is not working, we help her with other hormonal treatment like oral combined contraceptive pills or progesterones or metformin, those we use for the diabetic medication, like that category of medicines. So we add all the medicines to that. If the fertility is desired, we work on that in that matter for the induction of ovulation and other things. And ultimately, she may end up in IVF and all the things also. So it depends on that. And we monitor her regarding prevention of the long-term consequences. So we monitor her and then take the steps according to her symptoms.
What exactly are these long-term complications that you just mentioned?
See, long-term complications means the complications which may arise during pregnancy because of the PCOD. Then this woman, these are more at risk of developing type 2 diabetes in future, hypertension, metabolic syndrome. And there are sleep apnea type of disorders are there. They're more prone for that. And there are a few cancers like endometrial cancer, which is 2 to 5 times more common in these group of women, so especially when they are having very long periods of amenorrhea, long periods of absent menses. Those category of patients there. So we have to monitor them for that if they are developing this. If we see that kind of features, then we have to take the steps to diagnose it.
You just mentioned in your statement that you advise lifestyle changes. So in your patients that you see, what are the types of lifestyle changes that you actually advise them to undergo?
See, lifestyle changes means, first of all, the physical activity. They have to keep a watch what kind of physical, because most of the people nowadays, they are working on screen and the sitting position and all the things, the actual physical work done is already less. So they have to take special efforts in having the physical session, physical activity, exercises, at least 30 minutes per day of the moderate exercise for 5 days a week. That is okay. Then they should take care of their diet. I think we have a nutritionist. She will explain us better what type of diet and all we should take care of. So this exercise and diet are the two major factors. And then, as I told you, the sleep pattern, all these things, and the sedentary lifestyle that they have to take care. The stress management, though it is easy to say, but yeah, I know it's difficult to actually practically manage, but the stress management and all the things are the lifestyle changes which we advise them.
Are obese women more prone to PCOS?
Definitely. Actually, they are coexisting. Not all PCOS are obese, but we can say about 70% of PCOS women, they will be obese. But we have 20-30% of women who are not obese, but still they have PCOS. We call them lean PCOS. So that is also there because the etiology, the insulin resistance is a common factor, which leads to both the things.
I will come back to you. I will now go to, you mentioned about the nutritionist. So I think we have with us Ms. Nazneen Hussain, a food expert who is there with us. Ms. Nazneen, my first question to you is, what are some of the challenges you see with majority of young girls and young women dealing with PCOS?
Thank you, Mr. Shankar, and thank you, Dr. Shraddha, for putting this entire background. Hi. So, like Dr. Shraddha said, and this is, when we look at young girls, especially, who are still school going, and the moment you label them PCOS, there's this sudden, stress factor that, oh my God, something is really wrong. And that itself, many a times in most of my patients, builds more stress. And then parents just kind of, keep reiterating the same thing. So one is, my first goal as a nutritionist is I just help this young girl to get on to track to healthy eating. Having corrected that, a lot of things automatically kind of, get restored. Having said that, like Dr. Shraddha also mentioned, because they are in their teenage years and there's a lot of hormonal imbalance. So right from acne to hirsutism to, falling hair and the balding pattern, these are all very, very disturbing for young women. And it makes them extremely self-conscious. And because they are gaining weight and today everybody wants to look thin, lean, and in all their best clothes, and that's the time most of the girls are most conscious, these become real challenges. So most often, they don't come in for PCOS, but because of all these symptoms and or some beautician actually may have referred them because now she's having a lot of facial hair and something needs to be done about it. So these are some of the typical challenges with, most young girls and their parents face when they are actually coming in.
So when you come across a patient who is slightly obese, as what Dr. Shraddha said, that they're more prone to PCOS. So what is the advice that you give them? Do you just say modify food, have a change in lifestyle, go do exercise, or do you go beyond that?
No, we definitely do a lot beyond that. But to start with, we don't, we make the person at ease, first of all. So we just tell them, okay, let's just try with the diet. Okay, what are some of the things which you like? And then we try and incorporate, personalize this entire diet, trying to modifying their carbohydrate content or upping their protein content. Or if she's, not really into physical activity, we look at something which she likes. So we don't call it exercise, but we call it activity. And so if this young girl likes to dance, or she likes to swim, or she likes to do a Zumba class, we encourage her anything which is not like a compulsion, but is more fun and she is actively looking to do. So that's something which we definitely, increasing physical activity and of course modifying the diet are two things which we first work on. If it doesn't, and we work very closely with the gynecologist as well, then all the other interventions like Dr. Shraddha said that, putting her on oral contraceptive drugs or metformin, those we look at the second stage.
Now, the moment you tell a person or a young girl that she's a PCOS candidate, what's the reaction? Do they take it normally, or do they enter into a cycle of a small depression, and you have to counsel them and, as you said, put them at ease?
Yes, I think that's a very important thing, because I understand where the parents come from and they are worried about, infertility and pregnancy. But here is a girl who is 18 years old. She's not thinking about all those things. She's currently only thinking about that she has to go to college and she has to look good, and all of this needs to go away. And that itself is a lot of stress to her. So we look at, improving her entire cycle. We put her at ease. We tell her that, okay, if we do these things, if we inculcate some mindful eating, if we do some weight bearing exercises, look at exercises like Pilates, etc., a lot of it, the moment the weight is lost, a lot of things start coming under control. The hormones start regularizing and automatically the person starts feeling better. So those are definitely some of the corrective steps that we encourage them to do.
Today, these days, a lot of discussion on, the type of food that people should take, and mainly the impact of nutrition on PCOS. So can you elaborate on that?
Yes, Mr. Shankar, that is a very relevant point. And like even Dr. Shraddha said, that diet and exercise are two things which we emphasize. And, a lot of research around, because us as Indians also are very high carb eaters. So one of the challenges with PCOS is because there's so much of imbalance and there are so many cravings, people want to eat more simple carbs, right? So especially after a meal, a piece of chocolate, a mithai is something which one craves for. So those are some of the things which we help them to kind of overcome. Also, that overall there is so much of high consumption of high fat, sugar, salt foods in young population that itself has deranged. So moving towards nutrition today, like there are clear researches which show that maybe, a low carb or a moderate carb diet, but increasing the protein content and increasing the healthy fat content can actually help in reversing all the symptoms of PCOS. So definitely nutrition is a very key player there.
Can you also speak more about the role of gluten and milk?
Gluten and milk are suddenly into a lot of light and a lot of controversy. Whilst gluten is the protein which comes from the wheat, it in some populations it also shows some amount of inflammation. Now that doesn't apply as a blanket rule, and a lot of people always come back to us and say that we always ate rotis, and we, especially in northern India, not so much in southern India, but nothing really happened. But what we've seen is, if the moment we reduce on the wheat factor, especially the gluten factor, a lot of the refined foods like your bakeries, biscuits, cakes, pastas, noodles, all the things which all the younger population eats, that also goes away. Automatically, that leads to dropping of some amount of weight, and we see better results, especially in improving insulin sensitivity and reducing insulin resistance. So that's a positive for the gluten. However, having said that, if somebody eats 2 rotis with homemade wheat, I don't think there's a problem. However, we still encourage parents to, look at trying and incorporating some traditional millets like your jawar or your bajra or little millet like the foxtail, because these again have a lot of nutrients. So these nutri-cereals also help. So it's not about just completely cutting off gluten, but also introducing healthier millets, and that can be a good option. And about milk, yes, there is a lot of controversy about milk, especially because of the hormones being given to the cow. And today, a lot of people are actually going vegan, and for sustainability reasons or environmental reasons. So milk again is a huge controversy. What we tell them is that for basic purpose, yes, you go ahead, use milk, but don't go overboard try and use more fermented products like a yogurt, may be better than just drinking milk. We also, in many cases, personalize it. A lot of people have benefited going off dairy. Some people have shown no evidence using dairy and losing weight. So we actually take it person to person and personalize it. The research is still very bleak. It's not very clear whether one should completely eliminate milk and eliminate gluten. So we try and look at personalization in the diet. Some people benefit out of it, some girls don't.
Now, sorry, you spoke about these hormones in foods and other things, milk especially.
Yes.
Now, in our last episode, the previous episode, we had a discussion. A doctor said that these days, boys and girls are growing faster, taller, healthier. They look healthier at least. And one of the factors behind this is that you have hormones in all types of forms, growth hormones in all types of forms, either in the form of milk or meat that you consume, the eggs that you consume. Now, girls especially, their menstrual cycle starts very early in life, not like what it was probably a decade or two ago. So how does all this contribute to, a girl's life, and especially in connection with PCOS?
I think today, besides the hormones, we also do have a lot of endocrine disruptors. Like, we use far more plastic than what we used to. The stress factor is very high. The pollution factor is very high. We do have some epigenetic factors as well. So I think all of this together are creating a lot of havoc. And so definitely today, we eat a lot of young people ordering in food. Foods are often in plastic packages. They put hot food. Obviously, there's some amount of the plastic which is leaching into the food. So these are small things which we need to kind of really educate young girls about. Also, definitely the stress makes it even more worse, and today is very, very competitive. So typically the age of 16 to 18, so somebody is giving their 10th standard exam, their 12th standard exam. So it is also very competitive stress, and today girls are doing phenomenally well in their careers, and they want to kind of up their game better than the boys, and they're far more studious as well. So that extra hours put at work in studying is equal to loss of physical activity. So in that way, the boys are at least better, at least they're physically active. The girls completely leave everything and they only study. So that makes the symptoms far more worse for them.
Fine, I'll get back to you, but now I'll get a doctor's perspective on these growth hormones and other things that are there available in food and how it affects young girls.
Nowadays, really, the age of menarche has come down. Like, as you told correctly, that as we used to see 10 or 20 years back, now very young girls we see starting with the menarche. And the reason may be because of the lifestyle changes, as I told you already, and the food, that is one of the major important factors, and many things are implicated, though there is no evidence exactly what is the culprit in that. But food is definitely a factor with so many things, artificial things added to it, various preservatives added to the food. All these things may be the reason, and the lifestyle changes, physical activity again comes into play like that only. So all these things affect the maturation process in the girls.
What are the typical symptoms that one should look for in PCOS? If suppose there is a young girl, say in her 12 years or 15 years, but she does not know what changes are happening. So what are the typical symptoms that one should look for?
The symptoms of PCOS in young girls, when they have just started, means adolescent girls, we can say, there is a lot of controversy and challenge to diagnose PCOS in this age group. Why? Because the normal physiological changes of adolescent, those features overlap. What are the diagnostic criteria for the PCOS in adult women? Like the diagnostic criteria is abnormal periods, prolonged irregular periods, and then hyperandrogenism, that is male hormone excess, acne, and all the things. All these things are the normal features in the adolescent group anyway. So how to differentiate if this is a normal physiological process of the adolescence or this is because of the PCOS? So there are certain fixed criteria to say that. Like I can say that initial 1 year after the menarche, even if the periods are totally abnormal, we can just ignore it. But after 1 to 3 years after menarche, the periods delayed by more than 45 days. Then 3 years after menarche, the periods delayed by more than 35 days. These are considered as the features of PCOS. And acne also, mild form of acne, they may be normal feature of puberty, but severe acne, that is, there are no guidelines strictly, but severe form like more than 10 lesions, some say, or inflammatory acne, all this, and hirsutism, that is the abnormal hair growth, male pattern of hair growth over the lips, chest, and back, shoulders, all these types of hair growth, all these things are then the features. And most important thing is that I see most of the girls in this puberty age group girls, they come with ultrasound diagnosis of PCOS. They carry the ultrasound that, yeah, it was done and it is showing PCOS. The most important thing is ultrasound is not at all a criteria to diagnose PCOS in adults, at least for 8 years after menarche. Ultrasound is one of the features. As I told you, from that only it got the name polycystic ovaries, but that we use for the adult woman. But for the puberty, in puberty age group, that feature is a physiological thing. So we cannot use the ultrasound criteria for the diagnosis. So we diagnose depending upon the menstrual abnormalities which come into the criteria and hyperandrogenemia, that is the hirsutism, acne, and all the things. Sometimes, which is, if it is very severe, then even there is hair loss. That is, male pattern of baldness may be seen, and deep voice, all the changes may be there with severe form.
Now, I have a question from one of our viewers. I don't know how you answer it. He said, I just saw you speaking on, hair in the chest and hair in the lips and also women, but I am 18-year-old boy who does not have any hair, any mustache and other things, but I look pretty like a girl. So will I develop any complications? Is this because of some hormonal imbalance, and do you have to seek advice of a doctor?
I think he better takes advice from the endocrinological faculty of doctors, then they can advise him better.
But you would say that he does not have a problem as such because he is afraid that he might ultimately land up as a girl. Yeah, I didn't mention that in the question, but I'm just not taking the complete part of it, but only a part of it.
Yeah.
The likelihood, yeah.
Yeah.
Now, how does pregnancy get affected due to PCOS?
See, first of all, fertility itself is affected because of the PCOS. In overall, we can say 20% of the women with PCOS, they may have infertility. And even if the PCOS patient, they are conceiving, there are few things that are we have to be particular about it. Like they are more prone for especially diabetes. Pregnancy, we call it gestational diabetes. That is the diabetes which first time appears in pregnancy. So they are 4 times more prone for it. Then they are more prone for the hypertension during pregnancy. They are more prone for the low birth weight babies and IUGR, what we call it, and preterm deliveries. So all these are the things that we have to be particularly careful about. And so before they are, when they are planning for pregnancy, PCOS patient, first preconceptionally only we plan to screen them for any diabetic component is there, the glucose tolerance test is done, and then during pregnancy also, as compared to the other normal population, we screen them very carefully for the development of the gestational diabetes.
So you will have to closely monitor these patients across for their diabetes and also for their blood pressure. That's the way that you do?
Yeah, otherwise also the monitoring is done, but these people, they are more prone for that. So the tests for the gestational diabetes and all are done at an earlier period of gestation in this group of people.
Yeah. Now,
I'd just like to share a case study, Mr. Shankar, about this young girl who's been following. She's now not young anymore, but she's been following up with me over like 7 years. So she's a doctor herself, she's a dentist, and she had this long battle of PCOS, especially living in a hostel. Food was bad, no exercise, medical things were very, very challenging. So she gained around 30 kgs, after which for the longest time we helped her to kind of get back to her weight and battling PCOS. Finally, when she got married, she had this huge challenge of infertility. So over the past 5 years, she was trying to conceive, but with very little. And so we put on a very low carb diet, and we upped her protein content, increased her fatty content, and finally, she was able to conceive with some laparoscopic help, and she did over her infertility. Today she's pregnant with twins, and we actually monitor her almost very, very closely every day. So, like Dr. Shraddha explained, with elevated glucose levels, sometimes the blood pressure swinging either sides, she's still on a very, very stringent diet. However, sometimes the pregnancy cravings do come in, and she's a little haywire. But I think now she's almost on the 8th month of pregnancy. We're able to maintain her weight. To start with, she was 90 kgs, and now currently she's around 97 kgs. So we've not allowed her to gain too much weight, which will further become a challenge in her pregnancy. So I think it's encouraging. It was a difficult journey for her, but I think she's doing really well.
That's great. That's great. I think with proper advice, counseling, and also change in lifestyle patterns, things can really improve. But as you said, adherence is most important, because it's very difficult for youngsters to be away from food, especially the food that they like.
And I think infertility is becoming a bigger challenge, because there's pressure from the family, there's pressure within you, there is interpersonal pressure. So I think all of that, and plus you have a career, so all of it makes things very, very complicated,
Yeah. Fine. I'll come back to you, Dr. Shraddha. Now, is there any genetic factor to PCOS, in the sense, is it hereditary?
The genetic predisposition is definitely there, but we are not able to identify any particular genetic abnormality. But the genetic predisposition is one of the factors proposed for having it in few women. That is, in the families also it can be seen. It can be seen in the siblings also. Sometimes we see two sisters, they are coming with the same pattern of PCOD at the early young age and all the things. So the genetic predisposition is definitely there.
Now, PCOS shares some common features with metabolic cardiovascular syndrome, like MSC, a cluster of conditions that increase the risk of stroke, type 2 diabetes, and heart disease. Taken together, such findings have raised speculations that inflammation probably could play a key role in the pathophysiology of PCOS. What is your view on this?
See, chronic inflammation is considered as the etiopathogenesis of many conditions like PCOS, endometriosis. Also, we say there is a small amount of chronic inflammation going on, it can be because of the vitamin D deficiency and chromium deficiency. All these things they propose as a cause for the chronic inflammation, and then it can end up in PCOS, endometriosis, such type of things. But all these things are just speculations, and there is no evidence to say regarding this.
A recent survey that was done by IHL itself, the sponsors of this particular show, had said that in a survey they had seen that over 30% of women in metros like in Delhi, in Bengaluru, Bombay and other places, they are obese. And also they have this problem of high elevated blood pressure. So do you see that these women who are typically, in their 20s, late 20s or 25, 24, 25, very career oriented, do these people develop PCOS as such, or do they need to take extra precaution to see that they don't get into the zone?
So that is the reason, as I discussed, that is the reason for the increased incidence of PCOS nowadays, that everything is career oriented, no physical activity, just doing studies or doing their work. And so the obesity is definitely increasing in our population. And as a PCOD is having various features, obesity is one of them, and the insulin resistance. So, and different geographical areas, they have more predominance of a particular feature of PCOD. In India, overall South Asia, we see more of the insulin resistance, more obesity, more BMI, and the the waist hip ratio, that is the central adiposity, that is a more important predictive factor for PCOD. Then all these things are many things they share. It shares with the metabolic syndrome, like the glucose intolerance is there, hyperinsulinemia is there, hypertension, obesity. All these things are there, and so from the beginning only, the care should be taken, like exercise and diet and all the sleeping patterns to prevent it in future.
Now, there is a question from Bengaluru, a very typical personal question. It says, I'm a PCOS patient. I'm just about 27, but my husband and I have decided that we'll have kids only in the future, that is after 35. Can I preserve my egg for future once I go through the cycle, and I'm clear of PCOS?
She's a patient of PCOS.
Yes.
Egg preservation or embryo preservation also can always be done if they are having a plan for delaying the fertility for long periods because of the career reasons or any other personal reason. Then definitely we have to measure the AMH, that is the anti-Mullerian hormone. That is a hormone which gives us a rough idea regarding the ovarian reserve in the lady. So depending on that, we can take decision that how much time is there for her for the fertility life. And then if she is planning to delay it more, definitely she can go for the embryo preservation or egg preservation right now.
So that's safe, absolutely no problem.
Yeah.
Fine. I'll come back to you. I'll again go back to Ms. Nazneen. Ms. Nazneen, what is your opinion of types of carbohydrates consumption, especially India being a high carb eating diet nation? You had just briefly mentioned about it, but what's your detailed, sort of opinion on this?
I think it's very important that, we revisit our entire plate. Okay, and we kind of reduce the amount of carbohydrate foods that we're eating, especially the refined carbohydrates. So the idea is to increase the fiber content. In a very recent Indian study, it was realized that people consume less than 12 to 15 grams of fiber, especially women. And the average recommended amount is 25 grams at least for women. So increasing increasing the good carbs like the oats or the millets or your vegetables, all of these could be increased. The pulses again are a great way to increase carbohydrates and protein, but reduce the carbohydrate, reduce the refined foods. Especially today, there is a lot of interest in young people to eat cakes and biscuits and cookies and chocolates and pizzas and burgers and noodles. So even if it is homemade, I mean, most people order in a city like Bombay, people just Zomato it all the time. But even a lot of people now turn home chefs, do a lot of extensive baking, and a lot of sugar is used. And sugar is a very, very inflammatory food. Sugar and as well as maida. So, and Dr. Shraddha just mentioned that inflammation is on a rise and PCOS is an inflammatory condition. So overall, reducing the carbs help. In fact, we've seen that, even when we change the carb percentage to around, less than 50% and increase the protein content and increase the fat percentage, not only does the weight come down, the visceral fat comes down. Overall, the person is feeling better and the cycles are much normal. So, changing the carbohydrate, protein and fat ratio is a very valuable thing to do in such people.
You had mentioned about, refined things, not only food, but also the things that you take off the shelf in supermarkets, whether it be atta, whether it be any of these things. These are all highly rice. You don't get unpolished rice these days. So these also are contributing factors. Don't you think about it? Because everything, the world is going in the refined way, but it's a wrong way.
It's a wrong way. Like the very fact that when you read long grain polished basmati rice, is that the long grain is polished, so you've removed the bran, you've removed the top vitamins. The top vitamins are your magnesium, which is actually helps in improving the metabolism, and you've actually completely rubbed it off. So the more you refine it, the worse it gets.
So this is the only time where you can say the refinement is bad. Otherwise,
Yes.
People say you should refine yourself, but here this is bad.
Absolutely, very well said.
Yeah. Now, there is a lot of research on increasing protein foods for weight loss in PCOS. What is your take on this?
I think it's a fantastic thing because, like when we are educating our girls, I think the first thing I start is with protein. I tell them the to-do list last, or not to eat list last, especially the refined carb. But the moment you tell them, okay, up your protein content, increase, you can increase an egg in the morning, or like a cup of yogurt, or have a lot of sprouts in whichever form, like a chila, or sprouted forms, or if somebody is eating fish, then maybe like a fatty fish can be a great idea. So overall, improving the protein makes you feel very full. Today, you get some very meaningful, snacks also, which are high protein, and all of these keep you full. So the moment you feel full, your protein foods increase satiety. So the moment you feel full, your craving to eat all the junk suddenly goes away. And it's also thought, a lot of research actually shows that when you eat high protein foods, your BMR also increases. Your thermic effect of food increases. Thus, overall calories required is much lesser. So the weight loss process is much faster then.
Fine. So you said there are some healthy snacks. Can you give some example of these healthy snacks? Because people are always after snacking.
So you could use like maybe sprouts. You could use a fistful of nuts. So this could be mixed nuts, maybe walnuts, almonds, cashews. You could also use a mixture of nuts and seeds, which are both high in protein and fat. Maybe a bowl of hummus and some veggies could be used. Okay, even traditional Indian things like we eat a chole chaat. So instead of eating chole tikki, just eat the chole. That is fine. Or we eat ragda patties. So you eat the ragda, avoid the patties, which is made of potato. So you can still enjoy the tastier food, which is high in protein. However, reduce the carb content, and these are very, very satiating foods. So it makes you feel full for a very long time, like, sprout chaat, sprout bale. These are tasty items even for the young girls to eat.
Fine. I'll get back to you. I'll again come to Dr. Shraddha. Dr. Shraddha, studies have demonstrated that elevated biomarker of inflammation in women with PCOS, even once age and body mass index are controlled for. One recent meta-analysis concluded that these markers of inflammation are 96% higher in women with PCOS compared to those without the syndrome. What's your take on this?
Yeah, as we discussed, because these are all the chronic inflammation, markers of the chronic inflammation, though we are not investigating it as a routine basis. Means what the patients we get, we evaluate them for the diagnosis or to exclude other reasons for the differential diagnosis and to predict their prognosis and to plan our management. But all these things are the research-based things which we routinely don't investigate or evaluate in our group of patients. But this is one of the factors which is proposed, markers of the chronic inflammation.
So you just spoke of research. So what do you think as a doctor is a very exciting research in this field happening globally, and is something happening in India?
In India, the most of our research and all the things are focused more on the insulin resistance, as I told you, that insulin resistance leading to hyperinsulinemia, all these things in future leading to hyperandrogenism, and the ultimate, what are the physical characteristics and the ultrasound features. All these things are our main research topics, and not on all this chronic inflammation and all.
And what about globally? Anything happening globally on this field of research?
Yeah, these are the same pattern, that chronic inflammation, vitamin D. Vitamin D is very much under evaluation nowadays as a causative factor in the etiopathogenesis of PCOS, the chromium deficiencies and the deficiency of omega-3 fatty acids and protein deficiencies. All these things are under research for these things.
So a very simple question to you is, you said we spoke of vitamin D deficiency. Is it enough that if people, especially those who are not working in homes, expose themselves to more sunlight? And if so, at what time?
Sunlight exposure is definitely important for many things, not only PCOD. And I also cannot say that only getting exposed to sunlight will be the curative thing for PCOD. It's not like that. It's
for increasing vitamin D, I mean.
Yeah, vitamin D, they say that at least 20 minutes of exposure, daily exposure to sunlight is important. And that is also during the period of about 11 to 3 p.m., we can say, in the middle of the day. That time of the day, it is more beneficial for the vitamin D deficiency now.
So a 20-minute exposure per day is sufficient.
Yeah.
Do you also see, any geographical spread of PCOS? Can you say that this particular state or this particular area has more PCOS than this particular? Do you have any such data across in India?
The data means we can just say that it is more in the urban sector and as compared to the rural sector, where the lifestyle changes, lifestyle pattern is totally different. That is the things, but not relating to the specific area.
In one of our earlier shows, which of course was not much related to PCOS, but of course definitely, a doctor from Bengaluru, she said one of the major things for PCOS that one should also add on is yoga and meditation, because as you said, stress levels are more, and this could be this. And she also said these are the particular yoga asanas which would help you de-stress. So how important is this type of yoga and other things in a sort of de-stressing mode, so that it helps not directly to PCOS, at least a factor of it is taken care of?
Yeah, definitely. When we advise them the different types of exercises, these are all physically strenuous exercises, aerobic exercises. Along with that, yoga is also a part of this exercise pattern only. Various types of yogas, like the breathing asanas and breathing type of yogas, that definitely help in the de-stressing mode and all the things. And the different stretching exercises, what are practiced in yoga, they are helpful in that way.
In fact, this particular doctor, who is also a MBBS doctor in the sense that she's modern medicine, but she also practices yoga. So she was telling us that the yogic exercises that concentrate on the abdominal region is more important for these particular things. Of course, there's no linkage, but still it can help in alleviating this particular condition.
Yeah, definitely our target when we advise them exercises and all the thing is the weight loss. Weight loss as well as stress management, these two are the features, because weight loss is very important. Even if the lady is able to lose 5 to 10% of weight, then also about 50% of the women, they will start the ovulation pattern normal and the androgen levels are taken care of. So all these things are possible with the weight loss. So our main goal to advise them exercise and all things is concerning the weight loss pattern.
The moment you mentioned exercise, I think Ms. Nazneen Hussain is already into lunging into exercises with her presentation. Can you
so I just had some exercises very specifically, like, you could include something like lunges, you could include squats, also the plank exercises. So all of these work on the core area, and also some amount of, Pilates. So a lot of work, especially like you mentioned, yoga. So a lot of exercises, especially around the abdomen, and the helps in reducing the visceral obesity. So that is helpful. And like Dr. Shraddha also mentioned that, all the exercises working around the pelvic region, strengthening the core area, these could be especially very, very beneficial for all the girls for PCOS. So these definitely should be done on a regular basis by all of them.
Now a question to both of you, Dr. Shraddha and also to Dr. Nazneen. Now, you just mentioned about foods. What about fatty foods? Is that a demon for PCOS?
No, I think today, the whole guideline for fat has changed. So, in fact, when we look at a dietary distribution, almost 30% of the diet comes from fat. But that doesn't mean that we eat deep fried foods, or we kind of, order in all the fried foods, or we are able to, but choosing healthier fats like, the fatty fish or the seeds, the nuts, these are all very valuable forms of fats, and these could be included. Most of the seeds and the nuts also have a lot of magnesium, chromium, zinc, which are very essential nutrients, especially for girls with PCOS, and these could be consumed. So even a fistful of nuts and seeds at evening time or mid-morning time, or just sprinkling some seeds over your salad or your sabzi, can be very effective ways of using the seeds and the nuts. Of course, there is one more additive to this, that the moment you fry foods or you're using foods at very high ultra temperatures, we also have a concept called dietary AGE. So anything which is very high in fat, especially the trans fats or the saturated fats, of course, all of them are going to add to the visceral fat, but they also increase the inflammatory pattern. So something like a cheese, even nuts, if you salt them, roast them, barbecue them, then they are not good. So you need to eat plain nuts the way they are. Okay, because anything, the more you process it, you're increasing the inflammatory factor or the dietary AGE. So these are some of the things which one should be careful. But otherwise, fat guidelines today are far more relaxed.
Am I audible now? Or?
Yes, you are.
Yeah. So why I asked this question was, in some of our earlier shows, we had said that the nutrition especially had said that should the desi ghee is very important for health. So what's your take on that?
So see, desi ghee is a conjugated linoleic acid. We are allowed around 7% of saturated fat. So that could come from butter, ghee, or it could come from any of the, if somebody is consuming animal products, then it will come from there. But yes, a teaspoon of ghee can be used safely. Okay, that is all right. But that doesn't mean that you go overboard and eat it. But around a teaspoon is fine. And for greasing the roti, or some people add it to their khichdi or their rice, just for a little flavor, that should be okay.
What's your view, Dr. Shraddha?
Yeah, definitely we have to avoid, as Dr. Nazrin has already explained in detail, that we have to avoid the saturated fats, but definitely omega-3 fatty acids, as they are present in mainly fish and all the things that are more beneficial for the things.
This is because, both of you, because we are now heading into a festive season very soon.
Yeah. Yeah, I think this whole concept of desi ghee, especially, with the Navratra coming in, Diwali coming in. So little is allowed, but anything excess is bad, and that should be kind of definitely restricted. So use the nuts, use the seeds as your best friends, rather than using everything deep fried and mawa based mithais or too much of ghee laden mithais. These should definitely be restricted. Huh?
Food with high glycemic index and all the things to be.
Yes, foods with high glycemic index. Also, thank you, Dr. Shraddha, for that. Actually, also fruits. Many a times people think fruits are healthy and they actually start overdosing on fruits. So especially for PCOS, one of the better things is that don't restrict on high glycemic index fruits. Also don't consume them as your first meal. So the first meal you look at, either introducing a protein meal. So you can begin with a bowl of sprouts or a bowl of curd or some nuts. Then later on, if you want to have a fruit or your poha, or you have it at around 10:30. Don't eat more than 1 or 2 fruits, because again, the fructose content of the fruit again is sugar. And today, a lot of insulin resistance is also seen with high fructose foods. So, and fruits being a natural form of fructose. So don't go overboard on the fruits. Restrict fruits also to not more than 1 or 2 fruits can be eaten, but not more than that. Choose the more berry fruits, like what you see on my background, your strawberries, your blackberries, all the citrus fruits, all of these could be consumed. Avoid anything which is very high glycemic index. I think Mr. Shankar's network was a little unstable. Also, dry fruits, especially the dates and anjeer, 1 or 2 can be consumed. But when we say nuts and dry fruits, so most people think of even the fruits which are dried fruits, and the nuts which are dried, like the badam, pista, kaju, walnuts. These are nuts. So most of the times people are often confused and they put everything under the dry fruit category. So when we say nuts, they are protein and fat. When we say dry fruits, they are only carbohydrates and some vitamins and minerals. So we are looking at increasing more nuts. The dry fruits, again, you will have to restrict the quantity because it's concentrated form of fructose. So don't go overboard. Yes, you can have prunes, you can have one date, but don't go beyond that.
Doctor, I also want to ask you, in the nuts, is there anything special that these are the nuts which should be consumed more and these are the nuts should be better avoided, or it's in the same category?
So a lot of good research, especially with walnuts, has been done on PCOS women. And it has been seen that if you consume a quantity of around 45 grams per day, they saw better results in reduction of abdominal obesity. Also, that regularizing period was definitely seen, and better mood. So one was walnut. The second nut was also almonds. So consumption of regular almonds also helps in PCOS. So these are two nuts which are very, very helpful. There's a lot of work also around unsalted pistas is also emerging in. So these are three nuts which one can definitely look at.
I'm sorry, my connection got lost. So, I suddenly went off and I had to log in again. Yeah. This is one of the syndromes of modern day technology that, it suddenly appears and then you do not know what to do.
And one last thing I wanted to say is there's a lot of work around seed cycling today. So people ask us these questions on, can we have seed cycling? So they have the flaxseed and the pumpkin seeds in the first 14 days and the sunflower and the sesame seeds in the second. So all seeds are great. Whilst research on the seed cycling is not very clear, but definitely include seeds on a regular basis. It is good form of fat, zinc, chromium, and magnesium, and so definitely it should be included.
Now, you had mentioned about lifestyle changes, both of you, Dr. Shraddha, and now in the whole thing, how important is sleep?
Dr. Shraddha, you want to take that?
Sleep is definitely important. At least 7 to 8 hours of sound sleep per day is important for all the things. One of the studies say that if you are losing a sleep by more than 3 or 4 hours, it is more dangerous than having a high-calorie burger per day. So the losing of the sleep is also having the equal effect as if you're having very high-calorie food and all the things, and it definitely alters your biological clock. The biological clock is said that we see various hormones. They have different values at the different periods of the day. So when your sleep pattern is totally disturbed, this hormonal cycle, it's all hormonal orchestra. It's not a single hormone which is causing PCOS or any other endocrine or metabolic disorders. So this whole orchestra is disturbed because of the abnormal sleep patterns. So definitely a sound sleep is more advantageous.
Now, in this connection, I would like to ask you that more women, especially youngsters, work in this, what they call the graveyard shift in the night until early in the morning.
Yes.
Does this have any impact on PCOS in the sense that it affects the body?
It does cause, that's why all these computer people and all the things in those group of people, we are seeing nowadays more and more of the obesity, PCOS and all the things, because they have very haphazard working patterns, and it is not, sometimes it is not fixed also. Sometimes it may be day shift, sometimes it may be a night shift, and they are constantly losing their sleep cycle and all the things. So these group are, that's why it's more prone for all these metabolic and endocrine problems.
What's your take, Ms. Nasmi?
No, I completely echo what Dr. Shraddha said. In fact, there are two hormones, the leptin and the ghrelin, which directly kind of, influence your hunger and the satiety. And like I explained to most of the patients, this time gap between 12 a.m. and 4 a.m. is very important for you to go to sleep. I mean, you can sleep for 8 hours even later. And a lot of people, if they are not doing graveyard shifts, they are watching Netflix and Amazon Prime. So definitely the sleep is disrupted, and, no matter how much you try to catch up, the hormones don't catch up. And so you're not able to break that cycle. So just to make sure that the hormonal health is aligned, sleep is extremely important.
So I would put it as Netflix and Amazon Prime are also one of the prime causes for PCOS. because people stay late into the night, and this generation does not know how to sleep well. I think that is a major problem that they have, either due to work or due to external factors like what you said about TV and work patterns. But I'll conclude this session with one common question to both of you. How important is family support for young girls who have PCOS? Starting with you, Dr. Shraddha.
Yeah, this management of PCOS, we have to have a holistic approach. Means it's not only just giving the medicines and asking them to follow the lifestyle measures. The family support is definitely important because there are many psychological factors in PCOS associated. Means they have depression, anxiety, they're worried about their body figure and all the things. And the causative factors are also there. So family is very important in their emotional support, in helping them to cope up with the lifestyle changes and all the medical management. So family support is very important. That's why we see more of these patients, they are coming from the hostel background also, those who are not with the family, or they are because of studies or because of work, they are away from the family. Those group of patients are also more prone for this. Stress is managed in a better way when you are in a family. So all these things add to the things.
Ms. Nasin, your viewpoint?
Yeah, I completely agree that, family support is extremely important. I mean, here is a young girl who's trying to go on a diet, and like if the rest of the members are, eating chips, it doesn't really help the cause, So I think it's a lifestyle modification for the entire family, be it her parents, siblings, spouse. I think that kind of a support really needs to come in, because, only then one can make a difference. And of course, emotional support is required at all ends, whether it could, rather than just labeling people and, doing the blame game, especially this happens in infertility cases. There's a lot of interpersonal struggle. So I think a lot of support, even from the spouse, from the in-laws, I think that's what is required. And also friends can really step in by, becoming active exercise partners, and group exercise always helps. So I think this is social support definitely is a must. And, women should not feel scared to seek out for it. I think another thing is also seeking out for help. So I think we should go and actively seek help.
Yeah, I think I'll conclude saying that the major change would start with lifestyle modifications, food modifications, sleep patterns, and come back to a routine which probably is needed for a youngster, like growing in the teens and of course coming to the fertility age. All these things are very, very important in one's lifetime, one's lifestyle. So the first change that probably one has to do is with lifestyle, exercise, control food, control sugar levels, control fat. And probably these are the steps that will be taken. And I really thank both of you, Dr. Shraddha and Ms. Nasin, for the wonderful tips that you have given to our young population. Thank you very much for this show. And I conclude by saying that you have really contributed much to this particular cause of PCOS. Thank you very much.
Thank you very much. Bye-bye. Thank you.
Thank you.